to speak with Kimberly. Kimberly, thanks so much for coming on the program. We'd love to hear a little bit about yourself for the first 60 seconds or so of this conversation, and then we want to delve right into what's close and dear to my heart, especially with community development around the power of authentic engagement in the community. So over to you, Kimberly.
Thank you. Thank you so much. Honored to be here. So, program manager at Duke University in the Office of Community Health, and I've been doing that for over 20 years. And so my passion is with community engagement and also that intersection between health and faith. And so the two cannot be separated. And so I have the honor of being able to work in the community, working collaboratively to help address issues that are impacting the health and well-being of communities.
No, that's really, really wonderful. And I'm sure the audience has a lot to learn from your perspectives, especially around the significance of authentic community engagement, which is the title of this specific segment. Can you talk to that specific engagement and the role of that engagement in developing programs that address the various different social drivers of health and your belief in that engagement around contributing to like the overall health and well-being of the community that it's involved in?
Yes, it is so important. It is the cornerstone of all of the work that gets done in the community collaboratively to have that authentic engagement. And when I describe authentic community engagement, it's not just about ticking a box, or it's about fostering genuine relationships based on trust and respect. And so when you're working with multiple groups and individuals, that collaborative approach goes beyond of just informing people of what programs already exist, but get them actively involved with some of the issues that are impacting them. And so we are co-creating solutions to the social drivers that impact their health, as my colleague had mentioned earlier, those social and economic factors that also impact health outcomes. And so that involves being still and listening deeply to community voices, understanding their lived experience, and incorporating their unique perspectives into conversations. And so we can sit and develop programs and solutions together.
Yeah, absolutely. And you yourself has had a remarkable set of experiences. We'd love to hear about some past examples from your past experiences in relation to understanding community issues firsthand, like you were saying, being able to listen, and the approach in building trust and relationships within these communities, especially when you're addressing health and well-being concerns, which is sometimes a difficult topic to bridge.
It's about building relationships and trust, and that often means for some stepping outside of their comfort zone. It means not doing everything between the hours of 9 and 5 in the comfort of an office, but actually going out and being with the community and spending time with them where they are. And so breaking down all of those silos and barriers and just sitting with someone right where they are, walking beside them, and just really listening to what they're dealing with. But you can also see some of the things that they're dealing with. If someone's telling me about the challenges that they're having with transportation because a bus stop got moved, I'm going to go and see, where was the bus stop? How did it get moved? I will ride the bus with them so I can see what's happening along the way. What are the barriers to getting to an appointment on time? Is actually walking and being with and being empathetic to what they're experiencing. It better informs the solutions that we come together to solve.
Yeah, absolutely. Absolutely. I think that one of the things, that has also been mentioned in the previous conversation is about sort of long-lasting and sustainable methods of ongoing dialogue and collaboration with some of these underserved communities. So we'd love to hear a little bit about, when addressing these sort of community issues, are there any specific maybe strategies or tools or methods that you find most effective when when you're trying to foster these sort of sustained partnerships to lead on to more continuous improvement in the health and well-being of a community that you're currently engaged in?
Yes. Community councils or community advisory boards is one tool that we utilize in order to keep the conversation going because it's always bi-directional. It also helps in terms of accountability and also provides the community with a platform to voice concerns and offer guidance, but it also holds us as an organization accountable to our communities, and we keep that active engagement going, working collaboratively, and it also helps to adapt approaches to solutions and to address the inequities. But my favorite always is those one-on-one conversations that I have with individuals where you spend time with them in their space, working with them and really listening to them and taking a holistic approach. So someone who may be having a challenge with, for example, with diabetes, is not just managing the disease, but they may have other things that they're encountering. There may be problems with transportation, getting to and from doctor's appointments. They may not be able to afford the medication that they need, and then getting access to healthy foods. That's another issue. But by that one-on-one conversation, spending time with the individual right where they are routinely, that's beneficial. And also just spending time with people in the community or spending time with organizations, not just there at a church to organize a health fair, but actually attend the services and go to other community functions, go to the soccer game that's over at the community center, just become part of the community and really get to know them.
Yeah, absolutely. I think you touched on a really, really important point there in in terms of there's all this technology for communications and interactions and stuff, but nothing's really going to beat that sort of one-to-one, sort of personalized, sustained interaction with these different individuals in the community to to sort of have that sort of human interface. If you,
Yes.
that's
Mhm.
wonderful. Well, Kimberly, thanks so much. Well, unfortunately, we're at time, but I'm sure
Mhm.
you have a lot more insights to share with us.
Mhm.
We put your LinkedIn into the chat, so those of you in the audience, and you're getting a lot of love from the audience with some hand clapping and some digital hearts here. Please do connect with Kimberly to carry on this really important conversation about breaking down these barriers and sustaining continuous improvement in health and well-being of these different communities that we're serving. Kimberly, we'd love to have you back on the program again soon. And thanks so much for your time today.
Thank you for having me.